Because there are real possibilities of complications associated with the ablation procedure, like with all procedures, all cardiac procedures do have risks of complications associated with them to varying degrees. Because of this risk of complications, one needs to be sure that when one decides whether or not to do an atrial fibrillation ablation, that decision is based on a careful weighing of the risks and benefits. The risks, obviously, are the risk of the procedure itself, risk of procedural complications. The benefits would be a variety of factors, including possibly being able to get back to normal rhythm and maintain normal rhythm by getting rid of these AFib cells directly from the inside so that one can stay in normal rhythm longest compared with medications and other modalities without possibly using a bunch of medications, because you actually got rid of the rhythm problem from the inside, not just mask it with a drug. Other benefits are improvement in symptoms. Remember, all of our treatments for atrial fibrillation are for symptoms. As long as you don't have a clot and a stroke from atrial fibrillation, which is the most dangerous thing we worry about, everything else we do is just for symptoms. And so therefore, one of the biggest reasons to be aggressive in terms of treating atrial fibrillation, either with a more powerful antiarrhythmic medication to suppress it, or an ablation to try to get rid of it from the inside, is to try to treat symptoms for a long period of time to get the best long-lasting result. However, if one isn't having very much symptoms, then, or is of an older age, this may lend itself to a less aggressive treatment strategy towards atrial fibrillation. A lot of people who are in their 80s and 90s may say, look, I don't have to have the perfect result. Let me go in and out of AFib or be mostly in AFib, or let my AFib become permanent if it's already getting close to that point. I don't care, as long as I'm rate controlled and feel pretty good, even in atrial fibrillation. You just told me it's not directly life-threatening. So, if I was younger, maybe I'd want the perfect result. But at my age, just do least risky to most risky. On the other hand, younger individuals, oftentimes being young and healthy, might say, look, even if I feel okay in atrial fibrillation, even if my AFib is rate controlled and I feel relatively okay, I'm young enough and healthy enough that I want to take some risk up front and try to not just be an AFib for the rest of my life. I want to actually try to turn the clock back with the ablation, and maybe 1% risk is reasonable to me. On the other hand, having done this for over 20 years, I've had sometimes people in their early 80s say, look, my philosophy has always been, I fix things if at all possible, and I really don't want to take a lot of medications unless I have to, and I'm willing to accept more risk up front to try to get that result, because that's my philosophy and it works for me. I understand the increased risk and I'm willing to undergo it. Then again, I've also had some 50-year-olds tell me, look, 1% risk, that's too scary. I would never do that. Even at 50 years old, I would never do that unless I failed all medications. Even then I would have to think about it. So everyone's different, and it is not my job or desire to tell a patient what to do, and least of all, to bully them into a procedure. The last thing you want to do is be bullied into a procedure. Unfortunately, I have seen that happen in my career. I've seen people where they developed atrial fibrillation and were hospitalized for symptoms and were told that if they didn't have an ablation before they left the hospital, that they could die, which is possibly somebody just trying to make money by doing a procedure instead of treatment with the medication. I've also had patients come to me for a second opinion where they say, look, I've had 3 ablations and I'm still having a fair amount of atrial fibrillation, and now they're talking about doing a 4th ablation. Should I have a 4th ablation? And I discuss with them the reasons why we do atrial fibrillation ablation, and tell them, well, I'm assuming you probably have a lot of symptoms with your atrial fibrillation. That's why you underwent the 3 ablations. And sometimes they tell me, no, I have barely any symptoms of atrial fibrillation. I don't even know when I'm in atrial fibrillation. Then I ask them, well, then why did you have multiple ablations? And they say, well, because nobody bothered to explain anything to me, and they made me feel like if I didn't have an ablation, I might die. So this is the reason why it is so important to be properly educated with the facts about atrial fibrillation, because when you make a decision, whatever that decision may be, it should be based on the proper facts. It shouldn't be based on just being bullied or told to do something by a doctor. If a doctor comes into the office and just spends 5 minutes and says, well, you just need X, Y, and Z, well, maybe that's right, maybe it's not. But technically, atrial fibrillation should be customized or tailored to your specific situation, because when we're dealing with symptoms or treatment of symptoms, then there can be multiple right answers. And one way isn't necessarily better than the others. It's more pros and cons. The least risky thing to do would be slow the AFib down with a rate controlling medication and call it a day. And that might appeal more to older individuals who want to go less risky to more risky. Going up the risk ladder, you might want to do medication to suppress it that doesn't actually get rid of your atrial fibrillation cells. It just masks it until it can't mask it any longer. But you will keep forming more atrial fibrillation cells as you get older, and so that will eventually be overridden. And then lastly, you have the ablation procedure that might get you the best long-lasting result and keep you in normal rhythm for the longest period of time without a bunch of medications, but it's not a cure, and there are risks associated with it. And the more complex your atrial fibrillation is, the more skilled a provider you would need to go to try to get you the result. Not everybody does the same thing, and not everybody does complex procedures. So one's decision as to what to do and what is the right answer to treat their symptoms of atrial fibrillation from these different modalities should always be based on how much symptoms you're having, what your risk tolerance is, what your age is, what your personal preferences are, and which of these treatment options makes the most sense in terms of your symptoms and how much risk you're comfortable taking to try to treat those symptoms. It should not be based on just somebody coming in and spending 5 minutes with you and just telling you that you need whatever, an ablation or something else.